Yan. Good afternoon, sir. I am Ayra Leabres from BSN1 Block 1, and today I am going to perform a complete bed bath to a female patient. May I proceed po? Okay. So, first of all, for the goal of this assessment, it is to provide and assist the patient with personal hygiene, decreasing the risk of infection, and increasing patient comfort. So first, I'm going to introduce myself to the patient, verify the patient's identity, explaining the procedure to the patient, why is it necessary, what I'm about to do, and how the patient can cooperate. So, okay. Good afternoon po.
Good afternoon.
So, good afternoon po. How are you po?
Okay lang.
Okay, so ma'am, I am Ayra Leabres, a student nurse from Wesleyan University, Philippines, and today I'm going to take care of you from 1 p.m. to 4 p.m. So, for safety purposes po, may I hold your hand to check your ID band? Okay. So, can you please state your name and birthday po?
Richlyn, March 9, 2002.
Okay po. So, Ma'am Richlyn, as I was saying, I am here po to give you a complete bed bath. It is for your personal hygiene po. Would that be okay po? Okay, so may I proceed na po? Okay. So, verifying the patient's identity, ensure that the right patient receives the intervention and helps prevent further errors. Also, explaining the procedure to the patient facilitates cooperation from the patient and relieves anxiety. So, I'm going now to perform hand hygiene to prevent the spread of microorganisms and provide privacy to the patient by closing the curtain. Okay. So, before we start the bath, I'll assess the patient's ability to assist in the bathing process and personal hygiene preferences, and then review the patient chart for any limitation in physical activity. So, assuming that this is the patient's chart, okay, so mom, do you have any shortness of breath po? Do you suffer from any skin problems, skin condition? How about having difficulty in physical abilities po? Okay, that's good. So next, I'm going to encourage the patient to void prior to beginning the bath. So we're gonna start for the bath now. Do you want to void now? Okay. Then I'll raise the bed to a comfortable working height, lowering the rail on my side and help the patient into a supine position. So, okay. So since the patient is already in the supine position, we're just going to adjust her pillow. And then next, then I'll drape the bath blanket over the patient and ask her to hold the top edge of it as I remove the top sheet beneath it. Okay, so hold niyo po ito. And then, I'm going to place the soiled sheet into a linen bag. Okay. And then now I'm gonna remove the patient's gown and keep the bath blanket in place. So, if patient has an intravenous line and is not wearing a gown with snub sleeves, I'll remove the gown from the other arm first. And then, lower the intravenous container, hang the container, and check the drip rate. Okay. Then now I'm going to raise the side rails and lower the bed. So now, I'm going to fill the wash basin with a 2/3 full of warm water and have the patient test the water temperature to make sure the patient can tolerate it. So ma'am, can you check po if this water temperature is fine? Okay. And then afterwards, I'll begin the bath by immersing the washcloth in the basin, wring it out thoroughly, hold the washcloth to form a mist. Okay. Next, I'll be washing the patient's eye with pure warm water, bathing the eye from the inner to the outer canthus, and use a new section of a cloth for each eye. Okay, so ma'am, can I wash your eye po? Inner to outer canthus. Okay. And then, next I'll wash, rinse, and dry the patient's forehead, cheeks, nose, neck, and ear. Forehead, cheeks, nose, and ear. And then if the patient is male, we can ask him if he likes to be shaved. And then if the patient is unconscious, I'll wash the eyes with plain warm water, bathing the eyes from inner to outer canthus, and also using the new section of a cloth each eye. And if prescribed, I'm going to instill eye drop or ointment. If she has no blink reflex, I'll keep her eyelids closed. So, I'll gently close each lid with the back of my fingertip before placing an eye patch or shield, and never take the eyelid itself. Okay, then now I'm going to place the bath towel lengthwise beneath the arm and bat the arm with water and minimal soap using long, firm stroke, and move at a distal to proximal direction, then wash, rinse, and dry the entire arm. Okay, distal to proximal. Then dry. Then also wash the fingers and nails. And then moving on to the axilla. And if needed, we can use a deodorant to that patient. So since the patient doesn't need a deodorant, we can leave it be as it is. And then I'm going to repeat the same steps onto the other arm, assuming that I have already finished the other arm. We're going to proceed on the chest. Moving on the bath blanket into the umbilicus and covering towel the chest. So I'm going to bat the chest using a long, firm stroke, while the towel is still covering it. And if the patient is female, I'll take special care to clean the skin beneath the breast, lifting each breast with the back of my hand, and I'm going to rinse and dry the area well. Okay. Now, I'm going to check the water temperature and change it if necessary. Otherwise, I'll continue washing the abdomen. So next, I'll drape 1 or 2 bath towels lengthwise over the patient's chest and abdomen, folding the bath blanket down just about the pubic region. Abdomen. And then I'll wash and raise the abdomen under the towel, paying close attention to the umbilicus and the surrounding skin fold. Okay. Moving on to washing the lower extremities, I'll cover the patient's chest and the abdomen with the top of the bath blanket. And then I'll expose one leg by folding the blanket toward the midline while keeping the perineum covered and arrange the towel lengthwise under the leg. Okay. So are you feeling comfortable pa? Okay. Since so, I'll proceed on washing the legs using long firm stroke from the ankle to the knee and then from the knee to the thigh. Ankle to the knee and then knee to the thigh. So while I work, I'm going to also assess for any signs of redness, swelling, and pain. So I'm going to thoroughly rinse and dry the leg. Next, I'll also wash the patient's foot. Cleaning carefully between the toes, I'll be cleaning the nails as needed according to the agency policy. And rinse and dry the toes and foot completely. Note that it is the soaking the patient's feet in warm water for 10 minutes can help maintain cleanliness of toenails and feet, but never soak the feet of a patient with diabetes or any other patient with impaired situation. So just apply a little moisturizing lotion to the feet. Then, going to remove the towel, raise the side rail, and move to the other side of the bed. Now I'm going to lower the rail on this side and follow the same steps to wash the other leg and foot. So assuming that I've done that already on the other side of the leg, I'm going to proceed on discarding the towel to the linen bag and cover the patient with the bath blanket. So, while the patient is in a supine position, I'm going to provide a perineural care as needed and change the bath water. So, assuming that I'm already doing the perineural care, now with fresh bath water in the basin, I'll apply a clean pair of gloves lower the side rail and help the patient into prone or sideline position. So, ma'am, are you feeling comfortable po? Okay. So, now I'm going to wash, rinse, and dry the patient's back and buttock area. I'll pay particular attention to cleansing between the gluteal folds and observe for any indication of redness or skin breakdown in the sacral area. And then replace the absorbent pad if necessary. So, okay po. Tagilid po tayo, ma'am. And expose only the back and the buttock. Okay. Afterwards, if the patient's skin is intact, I'm going to remove my gloves and give the patient a back massage, if she like one. If not, I'm just going to apply moisturizer as needed. Okay. Then now I'm going to turn over the patient. Okay po. And then, dress the patient with a clean gown or panjamas, beginning with the affected side. So, ma'am, if you'd mind po, I'm going to dress you a clean gown. Then I'm going to help the patient with her grooming and comb her hair. And then I'm going to offer the patient if she wants to fix her makeup, only if it's a female. And then I'm going to clean and replace the bathing equipment. And then I'll proceed on changing the bed linens, remove my gloves, and perform hand hygiene, and dispose soiled linens according to the agency policy. So I'm gonna record the procedure, including how much the patient participated and how much she tolerated the bath. Document the condition of her skin and any findings such as reddened areas, bruises, and joint or muscle pain. And lastly, I'm going to report significant findings to the nurse in charge or to the healthcare provider. So, ma'am, if you have any concerns po, just tell me lang po, and I'm going to refer it to your attending physician. So, do you have any concerns po? Okay. So that concludes for our return demonstration for today. Thank you.